guys, welcome back to the channel. I just had my nails done. Look at that. Aren't they cool? I'm gonna take like the top questions from Google about fillers and answer them for you. So I came very prepared, wrote it all down on a bit of paper, an envelope, and I'm just gonna like wing it. I'm just gonna go for it, okay? Question 1. Oh, this is actually really hard to answer. How long do fillers last? It could be anything from like a month to 5 years, or permanent. Do you know what? I'm gonna come back to that once I've explained a bit more about fillers. Question 2. What are the different types of fillers? We haven't got all day, right? Hyaluronic acid fillers. The next most common one that I use would be calcium hydroxyapatite fillers. That would be something like, well, it is Radiesse. Then you've got PLLA fillers, Sculptra. Then you've got polycaprolactone, which is Elancei fillers. And then you've got PMMA fillers, Articol or Bellafill. And then you've also got some slightly weird ones like Novabel, which is based on alginate, which is no longer on the market, but there are some alginate fillers out there again now. Wouldn't use them. When it came to market, will it be about 6 years ago now? It's from Mertz, and yeah, a lot of people developed granulomas around the eye, so it was withdrawn from the market. This is not on Google, but which ones do I personally use? Well, you know me, I'm all about the hyaluronic acid. It's really my favourite thing to use. I do sometimes use calcium hydroxyapatite, especially if I'm doing a jawline. I will use Sculptra if it's somebody who has got an awful lot of volume loss and it makes more sense to use Sculptra. And I don't personally use Bellafill or Articol. Of course, there's also fat, which I haven't mentioned. I don't use fat either. Question 3. What are the side effects? Man, that's a really difficult question to answer as well. Google, you are not helping me. So, obviously we've got the side effects which are expected, like bruising and swelling. So these are not what I would consider to be side effects, because you can have these no matter what you do with the needle. You know, you're always going to have a bit of swelling and a bit of bruising if you pierce the skin. Newsflash. And you've got things like infection, which is really, really unusual. Migration of the filler. What that means is you pop it here, so you're doing a tear trough and then it winds up here. Or you're doing a lip and then it ends up outside the lip. To a degree, you're always going to get migration, especially if you're putting a lot of volume somewhere like the lip. It is not going to stay there. Chocolate. It's either chocolate or something else. Allergy. Now, allergy is kind of a weird one. What do I mean by that? Well, you can have a proper allergic reaction, say to the lignocaine that's in the filler, which numbs the skin up. You can also have this weird kind of immune response to fillers. So say you get unwell, you've got like a chest infection or a urinary tract infection, or you get gastroenteritis after a dodgy Chinese. Basically anywhere that you've had filled can swell up. Basically some of your white blood cells, called eosinophils, can become activated, and then they just kind of go looking for things that aren't part of you. You know, like Pac-Man chasing those little, what do you call them, things in Pac-Man? No, he didn't chase Ghost, Ghost chased him. Oh yeah. The little things. Okay, apparently they are called pack dots. We're all learning something here today. So yes, these white blood cells, they go after the filler like Pac-Man going after pack dots in the game Pac-Man. And they just kind of make your face swell up. Now, thankfully, it only lasts for as long as the original problem lasts for. So, you know, if you've got gastroenteritis and it's a couple of days. say if you are really unwell and you're in hospital with like a liver problem, as happened to one of my patients before, it can be a few weeks, but it does go away on its own. Occasionally, a patient might require a course of steroids in order to get a shot of it more quickly. I do have an image for you guys of someone who has had this problem, which I will put here, ding, for you now. This isn't permanent, it went away, but you can see she's kind of swollen. Ooh, what else? Then you have occlusion of a blood vessel. So you got lots of arteries and veins inside the face. You kind of know where they're gonna be-ish. You know what depth a particular vessel will be at. You don't necessarily know the pathway of that vessel. So what I mean by that is, like, for example, there's one artery which comes around like this from underneath your jaw. You know it's going to be there, and you know what level of the skin it's going to be in. You don't know if it's going to be here, or if it's going to go there, if it's going to go up there. You don't really know that. It's kind of important to have a good knowledge of anatomy, which is useful for what happens if you get filler inside of a vessel. Well, normally it's okay, it's fine, and it probably happens all the time, we don't notice it. If you're super unlucky, then because of the way that blood vessels branch and get smaller as you go down them, eventually, because filler and fat is particulate, it will get lodged in one of those branches, and the area of skin which is supplied by that branch then won't get enough oxygen and nutrients to it, and will begin to die off, which is obviously not good. If that happens, it's normally something which we spot pretty quickly because it looks very white. If it's not spotted immediately, it's normally the next day, and if you catch it by then and dissolve the filler, if it's possible to dissolve the filler, that is. Remember, you can only dissolve hyaluronic acid fillers. Although, having said that, I did see a recent lecture in Barcelona where a doctor had used a medication used to dissolve kidney stones, basically, and injected it into an area of the face where there was some nodules from radiesse, and it worked. Apparently it hurt like crap, but it actually worked, and it dissolved the radiesse there. So maybe we will see that coming into common practice at some point. But right now, the majority of people can only dissolve hyaluronic acid filler. So obviously in that case, if you see that there is some occlusion of a blood vessel occurring, then we dissolve the filler. You're kind of in a bit of trouble if you're in one of the countries where it's not easy to obtain hyalase to dissolve hyaluronic acid. And obviously the worst case scenario would be blindness. So just in the same way that you can have a blood vessel occlusion, say on the nose, and then the skin of the nose becomes necrotic and starts to die off, the same thing can happen in the retina. There are other weird things that can happen. So there have been a couple of documented cases of people having pulmonary embolisms, so that's blood clots on the lung as a result of having something injected into their face. There have been a few cases of brain infarction as well. These are with fillers and with fat, and they tend to be with like crazy amounts. There has been a case of bilateral temple injections which entered the brain as well. So these are kind of all weird and wonderful things that can go wrong as a result of having dermal filler. Obviously that's extremely rare, but be smart and pick your injector wisely, people. Maybe don't go to your mate who's just started doing it, eh? What are the permanent facial fillers? Well, I guess the most permanent thing would be fat. So once you've got that fat and stuck it somewhere else, and you know how much of it is going to stay there, because obviously when you put fat in another space. Some of it doesn't survive the transfer, but I would say that that's probably the most permanent commonly used filler. Things like PMMA fillers like Belafil and Articol I said to last 5 years up to 10 years, so I guess that's not exactly permanent, is it? I don't know why this question, this fourth question, is up there with the fifth question, what is the longest lasting filler? Like, why are people so obsessed with how long their fillers last for? I seriously don't get that. Why do you keep asking that question? Tell me. It doesn't make any sense. Why would you want the longest lasting one? Do you want to have the same haircut for the rest of your life? Do you want to wear the same nail varnish for the rest of your life? No. So why would you want your filler to last forever? It doesn't make any sense. You know, guys, we're all getting older. Your face is not going to stay the same in 5-10 years. It's going to be different. And guess what? Those huge Kylie Jenner lips that you thought were so cool in 2016 will make you look like a dumbass in 2030. Added to that is the safety factor. So if you've got something that you can't dissolve and something goes wrong with it, so say you get an infection or you get a blood vessel occlusion or you just don't like it, what are you gonna do? You're effed. So stop asking that question, it drives me crazy. Number 6, do fillers stretch the skin? It's a good question. I think if you have loads put in, then the answer is yes, it's gonna stretch the skin. Does it necessarily look bad? I think there's a very, very fine line which can be walked between a face being filled like to the brim and it looking ridiculous. So I think it's very important not to put too much in to avoid this. That's when people get those, you know, big chipmunk cheeks or that really like puffy look. And I think often it's because they've just been overfilled in that pursuit of getting rid of any line or wrinkle or getting more and more lift. Guys, it only works up to a point. It's a syringe, not a magic wand. There comes a point where you need to explore other options like ultrasound, radio frequency, laser, maybe even thread lifting, maybe even surgery, or maybe just accepting that, you know, these lines or this heaviness is gonna come. There's only so much that you can push back against it. Obviously, I'm not talking about myself there. This is the most evident if I've got a patient that is really, really overfilled and I know that I need to remove everything that's there and then refill it all in order to get a nice result. Because I am telling you, man, they freak out when you take that old filler away. Do not like it at all, because for years that person's probably been having more and more and more and more put in order to get this really overfilled plump look. So when you take that out, the skin looks really it looks really baggy, it looks really empty because it doesn't have that underlying filler anymore. Obviously, I replace it and put it back in the places where it's supposed to be. But yeah, that period in the immediate bit after it's done can be really scary for some people. Well, that's it, guys. Fun fact, this was number, I think, 7, possibly, on the list. Question was, should you massage your filler after it's been done? Kind of depends what you have done. I would go with whatever your injector says. In some areas it's better to massage it, in other areas you want to leave it alone. So anywhere where you want to get some projection, like if you're trying to create very high cheeks, you know, width-wise, then you don't want to massage it. Likewise, if you are trying to get lift here and you've had lots of little injections put here, then you do want to massage it and you want to go up. You do the chin. I ask patients to go like this because it helps the product to integrate better into the tissue and it looks more natural. I'm all about that. Okay guys, so that is it for this week. I am putting more stuff on Instagram stories. In fact, I'm going to film it right now. So I don't know when I'm going to release it, but I will put a notice out on YouTube. I'm also gonna try and film some more roasts. So if you haven't yet been roasted, then please send in your pictures. Unfortunately, I filmed like a bunch of them at the same time last time and it didn't work. So if you weren't in the last roast video and you would like to be, it would be really cool if you would send your photograph to the email address rather than on Instagram. I do have some of yours, but if you sent it to me on Instagram, please send it by email because the picture quality is so much better. And this is of course assuming that I get my nice new iPad in time. Today's catch is Novexpert Lifting Serum, which I'm going to be discussing on Instagram TV right now. So head on over there. I'll see you next week. Bye bye.